Welcome to Hypnosis Today, the nation's first web TV talk show that explores the fascinating world of hypnotherapy. My name is Lisa Machenberg, and I'll be your host, covering a wide variety of subjects to help you better understand the power of the subconscious mind and how hypnosis is being used today to create success, happiness, and prosperity. I'd like to introduce my two very special guests. Well, my first guest is Golnaz Rafalian, and she's an honors grad of HMI College of Hypnotherapy. She is also a PhD student at the Art of Living in Irvine, California. And she has with her her very special guest and client, Bethany. Now, Bethany, I want to make sure I get this right. Bethany came in to see Naz for two very serious medical conditions. The first one's called spasmodic dysphonia and muscle tension dystonia. And we're going to learn how we can use hypnosis to help alleviate some of the symptoms of medical conditions. Please help me welcome my guests. Bethany, I want to start with you. That sure is a mouthful. In layman's terms, can you please tell us what was going on with you?
I worked in sales for many, many years. My entire career had been in sales, and I'm a very social person. I started chronically having, it sounded like severe laryngitis, and yet I felt a closing in, a tightness in my throat that just over time became more and more severe. After seeing approximately a dozen medical doctors and having surgery on my vocal cords, I was diagnosed with spasmodic dysphonia. And after 2 years, they added to the diagnosis of muscle tension dystonia. What that is a misfiring of neurons in the brain triggered from long-term extreme stress. That started, my body just started responding to the stress in the manner of closing my muscles, having spasms that couldn't be relaxed by any medication.
So you did have a diagnosis, you did have everything showed up on a brain scan and on muscle scans. What was the medical intervention that they tried for it?
The only thing was really more a Band-Aid effect, and they would inject my vocal cords, my voice box, and my strap muscles in my neck with Botox.
With Botox? Well, I bet they looked fabulous, but were there any other effects of it?
Well, I would go from being hoarse in speaking and not having much of a voice to when they put the Botox, I still didn't have a voice, but now because I had no control of my vocal cords or the muscles in my neck, so I would be a whisper of a voice, and it would slowly become stronger, and then it was just a vicious cycle. About every 4 months I was back in. It was extremely expensive. And it really wasn't a desired way of living. I didn't have a voice at all.
Well, you know, most people would think of maybe going to another doctor, going to a specialist, or going down to the Mayo Clinic. What made you think hypnotherapy?
Naz actually was recommended to me by a friend, and just in sharing, almost immediately my friend told me how amazing she was and how she felt like I could really have a lot of success. And you know, at this point in my life, in this stage of my treatment, I'm open to anything experimental or whatever it was, so I was completely open. And I have to say, after my very first session, it was almost a euphoric feeling, like everything, it just seemed like a burden was lifted and things started falling into perspective, and it's almost in an unexplainable manner, but it was amazing.
This is really amazing, and I want to go back just a little bit. This was a client that you had seen before, correct? And then she referred her friend to see you. And I want to commend you, Naz, because you know the best way to get referrals is to be a stellar hypnotherapist like you are. And then you don't have to advertise because everybody tells everybody, right?
Yes, that's true.
Now, I know you're not a medical doctor because you're a student here at HMI College of Hypnotherapy. How did you know what to do for Bethany?
You know, medical conditions get worse with tension and stress. So when I first met Bethany, I knew that I have to take her stress away. So we use a method in hypnotherapy that we call it imagery.
Imagery, can you tell us about it?
Imagery is a technique that we are using for various kinds of issues that the client might have. And it actually, we are taking the clients to an imagery place, whatever they like, a serene, comfortable place that they like. It could be a garden, a beautiful beach, or meadow, or whatever.
So I'm going to stop you there. I'm going to go back to Bethany. when you used your imagery, which is the imagination, correct?
Correct.
And you wanted to pick a beautiful, peaceful place. What was your image of?
At one point, it was an ocean. And in my mind, as I pictured the ocean of dolphins jumping, for me, water is very peaceful and tranquil for me.
Yes.
And in that place, I found that I was really able to just relax and kind of let the process take place.
Excellent. I didn't mean to interrupt you. So
No.
you go to a peaceful place,
Yes.
and then what?
And then we put the clients into hypnosis, and we give them post-hypnotic suggestions, which we take the negativity and we replace it to positivity. And in this process, because it's imagery, the mind doesn't know what's the difference between imagination and reality. So what it does is whatever we give the brain learns it, and then it replicates afterward in full waking state.
So in a full waking state, it can replicate what the neurons learned in hypnosis.
Mm-hmm.
So I need to ask, certainly, picturing an ocean, picturing beautiful dolphins, I can understand feeling very, very peaceful in hypnosis, in the hypnotic trance. What was it like when you awoken from the hypnotic sleep?
Initially, you just feel really relaxed. And the key is obviously taking it from that place and continuing that as stressors come into daily life. And it has been a process working with Naz, but I have to say it's a process that's been absolutely amazing. I feel at this point it's life-changing for me to learn kind of how to take in stressful moments and stop everything and then go back to that place to relax, reset. And it's a process that I'm still learning, but it's one that I'm growing with and continuing to work with Naz on.
So when you feel stress, you're able to access that image and therefore those feelings and be able to release the stress, correct?
Right.
But now we want to get to the real question. What happened with the throat, what happened with the voice, and what happened with the medical symptoms that you were experiencing?
Well, obviously I'm talking right now.
I can hear you.
And I have, if only you could have heard when I'm severely strained. It literally is as if somebody has their hands around my throat and are choking. And if you've ever, had kids and seen when somebody's choking, how that their voice becomes strained or barely a whisper, that was my life. And it was very frustrating. And now at times when I feel that those symptoms coming on, like I said, I'm just working with different techniques that she's taught me on a daily basis of just putting the positivity in, leaving the negativity out, and shutting it down. The minute it comes, the minute the stressors come, I just don't allow it to penetrate my aura anymore.
Well, I like what Bethany said, and she talked about methods and techniques. Naz, can you teach us another one?
Yes, what I usually do with my clients, arm rigidity. We call it arm rigidity.
What is that?
What we do is that we take the client's hand with the permission, of course, and then we put all the stress, all the negativity, all the tension, fears, phobias, and in her case, pain, to the hand, and the hand automatically it gets very, very rigid and sturdy, just like a steel bar. And then with the help of hypnotherapists, we release the pain, we release the negativity, and it works beautifully.
So do you use that technique too when you feel the stress and the tension in the throat coming back?
At this point, I've used that primarily with the hypnosis, but I feel like in that process, so much of it is released. With our subconscious versus our conscious, there's so much in our subconscious that we're unaware of. So the process of the hypnosis allows that to kind of be released, let go, taking the negative out and putting the positive in. So I'm able to kind of process the daily activities in a different method and kind of releasing the negative triggers, so to speak, that normally would set me off or upset me. I'm able to kind of step back and take things in a calmer manner.
Well, the reason I like that is now we have two full methods. You have one that you can use in a waking state when you feel the stress. Take a deep breath, let it go, picture the ocean and those beautiful dolphins. But when you had Bethany in a deep hypnotic trance, you let the subconscious release the negativity. So now the things that used to trigger you don't trigger you anymore because they've been released and let go. Now that you have your voice back, well, first of all, have you been having any more of the Botox shots in your neck?
No, I have not.
When was the last time you had it?
It's been almost 2 years, but I can't say that in its entirety was because I didn't need them. My work with NAS has been recent, but I was just exploring different medications, just finding, a new way of dealing with it. I've tried voice therapy, I've tried a lot of the medications have extreme side effects, and they're all experimental. I mean, I've been to the best doctor in the US at UCLA. It took him to diagnose the condition, and it's still a very underdiagnosed condition. So there's not a lot of treatments for it, and I just feel like it makes sense that when you have stress and you're internalizing it, I thought I was Superwoman. I was a single mom and working full time, and at some point I put myself through school while working, while raising 2 kids, very active in sports and cheer and all these things. And I felt compelled to excel at everything. And that's a lot of burning the candle at both ends, and it caught up to me, so to speak. So now just learning to reset and replace all of that with trying to put the negative out, stop allowing it to penetrate, and kind of been practicing a bit with trying to be able to put myself into a trance state on my own when in between my sessions with NAS, so that I can, if I feel like the week's getting crazy and life's getting difficult. My daughter just had a baby last week, and there's a lot of things going on with that. So to be able to just, if I can share, my grandson was having difficulty after he was born, and I took him, I'm going to get emotional.
It's all right. We have tissues here.
I took him and held him in my arms and just really went to a place and spoke to him and held him and put it, in essence, it's like a prayer, but at the same time, just sending the positive vibes and the energy. And he wasn't eating, and they were talking about putting a tube after like 12 hours, and that was literally the 11th hour. And just slowly he started to, think about eating, and it's a process with a new baby anyway, but he had swallowed amniotic fluid on his way out. And it's those moments where that I could tend to start with anxiety and the throat closing, and I just took him in my arms and walked away from everything and everybody that was here and held him. And I just started talking to him and, saying, it's okay, you're going to be hungry, you're going to latch on, you're going to eat, you're going to be a big boy. He was already big, but, and I shared that with Naz, because my last session with her, that birth was coming up, and I felt really positive that I was able to go to that place, and otherwise it would have been different.
Well, certainly, I believe in that kind of energy, and certainly when we generate that positive energy, we teach it to our clients then learn it. And I think that all hypnosis is self-hypnosis, because you go in with your permission.
Right.
And then you have that wonderful energy, and you're able to pass it on to a brand new soul who is certainly very, very receptive, and a big boy, and very hungry too.
Yes. And that he is.
How is the baby doing now?
He's doing excellent. I mean, he's a little porker, he eats a lot. And for his age, we wonder if we should stop feeding him because he's always hungry. So
send him another message.
Yeah, it's okay. He was born almost 9 pounds, and so he's doing fabulous. Thank you for asking.
Well, we'll all send positive energy to Naz to spread to all of her clients, and to Bethany, and to all the brand new souls who have come in. And I want to thank you so much for sharing your story and sharing your experience.
Thank you, Lisa.
And I want to thank Naz, but you know what? It appears that we have to take a short break. But when we come back, right after the commercial, we're going to meet another HMI hypnotherapy, and we're going to learn how to help somebody who's experienced food phobias. So stay tuned. We'll be right back.
Thank you.
Welcome to Hypnosis Today. Bethany, I want to make sure I get this right. Bethany came in to see Naz for two very serious medical conditions. The first one's called spasmodic dysphonia and muscle tension dystonia. And we're going to learn how we can use hypnosis to help alleviate some of the symptoms of medical conditions. Please help me welcome my guests. Bethany, I want to start with you. That sure is a mouthful. In layman's terms, can you please tell us what was going on with you?
I worked in sales for many, many years. My entire career had been in sales, and I'm a very social.
Introduce my two very special guests. Well, my first guest is Golnaz Rafalian, and she's an honors grad of HMI College of Hypnotherapy. She is also a PhD student at the Art of Living in Irvine, California. And she has with her her very special guest and client, Bethany. Now, the nation's first web TV talk show that explores the fascinating world of hypnotherapy. My name is Lisa Machenberg, and I'll be your host, covering a wide variety of subjects to help you better understand the power of the subconscious mind and how hypnosis is being used today to create success, happiness, and prosperity. I'd like to